Okay, so let's talk about a completely different arthritis, and that's rheumatoid arthritis. Okay, so yes, there's joint destruction, but in a completely different way. This is an inflammatory arthritis, and we think it's an autoimmune disease that ends up attacking not only joints around the body, but multiple other organs and other areas of the body. Okay? Rheumatoid arthritis tends to be a symmetrical joint involvement, meaning if the left joint is involved, your right joint's likely involved. If your left knee is involved, your right knee is going to be involved. So symmetrical joint inflammation and destruction. Okay, and it's a lifelong condition, right? So if you develop it at the age of 20 or 25, um, by the way, much more common in women, it's a lifelong condition of remission, so periods of time where the inflammation has settled, followed by exacerbations and worsening of symptoms. Okay? So I mentioned it affects women. Well, here you can see 3 times more frequently than men. Typically leads to a lot of joint pain, stiffness, and joint deformities. Okay? So when is the stiffness the worst? Typically in the morning, right? So someone's been laying in bed all night, they haven't moved their joints, and because this is inflammation, it's an inflammatory arthritis, their joints are extremely stiff in the morning until they start to get going and moving the joints through the day. Okay, so this type of arthritis improves with activity, and while you sleep overnight, the joint has filled with more fluid, it's become more stiff, and you have increased morning symptoms until you start to move the joint. Okay, smoking increases the risk of developing rheumatoid arthritis. Interestingly, so we'll talk about the risk factors of rheumatoid arthritis in an upcoming slide, and we'll also look at other parts of the body that are affected by rheumatoid arthritis. So don't think of this arthritis as only affecting joints. Rheumatoid arthritis affects many parts of the body. Okay, so this can be any joint in the body. Let's just say it's a finger joint. Okay, so on the left, a normal joint, you have healthy cartilage. You got a nice capsule around the joint. Inside the capsule, you have what's called the synovial membrane, which is almost like an inner saran wrap holding the synovial fluid. And remember, the synovial fluid is what feeds the cartilage. Okay, so from out to in, there's a joint capsule, and then synovial membrane, and then synovial fluid within the joint. Okay, the middle one is osteoarthritis, where you have a worn out cartilage and bony breakdown with cysts and osteophytes. Okay, that's the wear and tear arthritis. Rheumatoid arthritis, there is swelling, inflammation of the synovial membrane, and it's producing more synovial fluid. So the joints often look swollen, inflamed, warm, and it leads to cartilage destruction and bony erosions as well that we'll see. Okay, so of the two, osteo versus rheumatoid arthritis is the inflammatory one. Okay, and when we think of rheumatoid arthritis, what are the clinical features? Well, it's that morning stiffness, right? Because you've been laying there, the joints haven't been moved, and they're filled with synovial fluid. They're very stiff in the morning, and they get going throughout the day. Okay? Typically, there needs to be at least 3 or more joints involved. So it's not like you can have one joint and call it rheumatoid arthritis. There's typically 3 or more joints involved. Often it's the joints, it's the small joints of the hands, okay? So it's the metacarpophalangeal joint, so the MCP joint that that can become really inflamed, and the first joint of the fingers, which is the proximal interphalangeal joint, they can become really inflamed as well. Okay. Remember, it's a symmetrical joint. We spoke about that. There's rheumatoid nodules that can form, which are these soft tissue nodules that patients can develop behind their elbows, for example. In the blood, the test that we use is called rheumatoid factor. So that's actually a blood test that we can look for. And with elevated rheumatoid factor, that's very helpful in diagnosing rheumatoid arthritis. Okay. And lastly, it has a typical X-ray appearance. Okay. It has a different way of destroying the joint compared to osteoarthritis. Okay. So not only do we see cartilage breakdown within the joint, but there's bony erosions forming around the joint. Okay. So this is really just to remind you that rheumatoid arthritis is not just a joint condition. It's a systemic inflammatory condition where a lot of different parts of the body can be affected. So you can get inflammation of the linings of the heart, called pericarditis or myocarditis. You can have inflammation of the lung, that we call pleuritis, or interstitial fibrosis, which is scarring within the lung. Okay, they can develop inflammatory conditions of the eye. I mentioned the rheumatoid nodules, but behind the elbows. They can develop Raynaud syndrome, which is that vasoconstriction of the small blood vessels going to the fingers and toes. So there's an assortment of symptoms that patients have with rheumatoid arthritis because of its systemic inflammatory nature. Okay, so let's continue on here with rheumatoid arthritis. So what is it? It's an autoimmune disease of joints and other tissues in the body, as you saw on the previous slide. Okay, and there's circulating rheumatoid factors, and we think they're autoantibodies. And we can do a blood test for rheumatoid factor that can help in the diagnosis of this condition. Okay, so what happens to the joints? Well, there's synovial membrane inflammation. So that nice inner lining called the synovium or the synovial membrane becomes really inflamed. It produces a lot of inflammatory fluid within the joint, and that's why the joints are typically very swollen, because they're filled with fluid. Okay, so there's ongoing chronic inflammation in the body, and it often affects the small joints of the hands, the wrist. It can affect the feet, hips, knees. There's many joints that it affects, and it's typically symmetrical and bilateral. Okay, this is far less common than osteoarthritis in the population. Don't forget about the rheumatoid nodules, which are these soft tissue nodules at the back of the elbow that can develop with rheumatoid arthritis. And in terms of the autoimmunity aspect, while there's B cells that produce antibodies that directly attack the joint surfaces, right? And that's what we refer to as the rheumatoid factors, or rheumatoid factor, that we check in the serum. Okay. So let's just see what rheumatoid arthritis can cause. What are the results of this condition? Well, it's an inflammatory condition, so it's definitely going to cause joint swelling, right? And the joint swelling with the extrasynovial fluid is going to reduce joint mobility. So it's going to be hard to use your hands, right? Because of all the swelling in the joints. And that can occur in the hips, in the knees, in the ankles, shoulders. Any of the joints can be affected by this, leading to ongoing chronic stiffness, which will gradually result in loss of function of the joints because the joints are being destroyed by the inflammation. As the joints are destroyed, the muscles around the joints aren't used as much, and you get muscle atrophy. So if you look at the hands on the right, look at the back of the hand. The muscles, you're starting to see the bones, and below the bone, or on the side of the bones, there's very little muscle. It's starting to empty out. Okay, there's typically nice muscles between the metacarpals, and people with rheumatoid arthritis get muscle wasting around the joints. Okay, so and as the muscle begins to atrophy, and the tendons are of course involved because they're attached to the muscles, you start to get deviation of the fingers, for example. So again, on the image on the right, this person has what's called ulnar deviation. Okay, so the fingers are starting to bend towards the ulnar side because the muscles and tendons are starting to atrophy. Okay, and remember, this is a condition of remission followed by exacerbations all throughout life. Okay. So we spoke about the ulnar deviation. We spoke about the fact that this is a symmetrical condition, and also there's an image here of rheumatoid nodules on the back of the elbow, which is the most common place to see them. Okay. Okay, so how are we going to treat this autoimmune disease? There's no cure for it, so it's a chronic lifetime condition. So one of the main parts of treatment is pain management. People have a lot of painful, stiff joints, right? So we'll talk about some medications in a minute. Heat therapy can be helpful to get the joints moving, especially in the morning. Prevention of disability. So as the disease progresses, patients are going to lose more and more mobility of their joints that are affected, and also they're going to have muscle atrophy because the joints aren't being used, right? They're stiff. So physiotherapy can help with muscle strengthening and range of motion exercises to try and maintain movement of the joints. Okay. In terms of the medications, we want to use anti-inflammatories because this is an inflammatory condition. So we want to try and settle down the inflammation with some kind of non-steroidal anti-inflammatory. Okay, so ibuprofen, naproxen, there's many anti-inflammatories that you'll learn about. Okay, and we now have medications called anti-rheumatics. They have a longer name, but when you do a module on rheumatoid arthritis in another section, and in pharmacology, there's a group of medications called disease-modifying anti-rheumatic drugs. So DMARDs, D-M-A-R-D. Okay, yes. So DMARDs. So what do? Well, they try and address the autoimmune attack on the joints. Okay, so they're typically immunosuppressants. So they reduce the body from attacking its own joints. And a very common one that you'll see with rheumatoid arthritis is methotrexate. Okay, there's many others that you'll learn in pharmacology, but in general, methotrexate is a pretty common one that you'll see with rheumatoid arthritis. So just know the two components: the anti-inflammatory to treat the day-to-day inflammation, and the anti-rheumatic medications, which are immunosuppressants typically, to try and stop the long-term destruction of the cartilage and the joints. Okay. And for flare-ups of rheumatoid arthritis, so if someone comes in and presents with increased swelling of joints in their hands, more stiffness, swollen knees, swollen, painful hips, well, we can give them a short course of oral corticosteroids, and they are powerful anti-inflammatories. And this typically settles down the acute flare-up. So we try to use corticosteroids for a short period of time and the lowest dose possible to control the flare-up because of all the adverse effects that patients get while on corticosteroids.